It's on. So I'm here working with my golfer friend, and he's getting a little groin pull with his golf swing, and how we're addressing it is to rebalance the hip muscles. What happens is somebody's swinging through their golf, when they're swinging in their golf game, they need to clear their hips, and they end up doing this. So it's kind of arcing through the adductor muscle. So, but it's only on one side of the body. So what happens is you end up getting increased stretching and strain through the adductor muscle, and this side ends up just being tight. This side's loose. This side becomes weak as well, and it starts to break down the tissue. It's like a repetitive injury. So what we did is we're designing a certain program specifically for his needs and his swing, which is to strengthen the muscles as well as keep them loose. So it's a very simple exercise, and it's not complicated. So we want to bend up your knees. I generally recommend you don't jack up both knees like because then you just overactivate the psoas muscles pulling the back. It's much safer to just one leg at a time. Then you're going to do abdominal bracing, which is what I call it. You breathe in, exhale, suck the belly button towards the spine. Now keep that stabilized. As you lower your leg down, you're going to keep the knee locked, and then you're going to externally rotate the foot just to where it's comfortable. It doesn't have to be fully out here. It doesn't have to be just to where your body tells you. You have to listen to your own body. And you slide your leg out to where you feel a little bit of a pull and a stretch, and you hold it there. That starts to strengthen the muscle in of itself. Then you also want to, you still keep the stomach tight. You're going to lift it up and back down. You can see mine even tremble a little bit because I'm not working it like as if I would need to do it. So that's how I would stretch the adductor, as well as starts to strengthen it, and just even keeping it out there. You could do this off the edge of your bed, even if you were on the field or something if you wanted to, but it's probably not the best place to do it. It's better to do it on a higher surface. Coffee table, that's safe obviously. And then you bring it back in. You want to do the other side. You got to keep them balanced. So again, notice here, the hips are not, I'm not going to lower my leg, and if I really turn it out and kick it way over here, these hips come up, all this stuff, you're compensating. You're not keeping things isolated, and that's okay depending on what the purpose is. This purpose is specific directed towards the adductor muscle. Here, and I'm going to lower this leg so you see it. I would keep it up to just kind of help my pelvis to stay stable. It just depends on what's comfortable to you. Slide it out and lift. And I would start out, if it's really hard to do, I'll start out with 3 to 5 reps, maybe 3 to 4 sets. And if it feels okay to do more, but you want to stop when you start to feel a pull and a strain. That's the body's telling you to take a rest and take a break, switch sides. So we switch sides. And that's how it should be done, according to my philosophy. Hold it as an isometric. What that does is it keeps a strain on the...
I stopped it.
Okay. It's probably too long.
No, it's good.
So,
Oh, it's up here.
yeah, 4 minutes.